Well, the flu is spreading fast across Washington. State health officials are already seeing more cases this fall, and they recommend everyone get vaccinated with a flu shot.
Yeah, there's been a big debate about this over the years. Is it worth it, and can it actually keep the flu away? KREM 2's medical reporter Rose Beltz has more on how effective flu shots really are.
I had the opportunity to speak with two flu experts, Dr. Joel McCullough, Medical Director for Community Health and Epidemiology at Providence Healthcare, and Paul Throne, Director of Immunizations for Washington State Department of Health. They both agree the flu vaccine, it's not perfect, but it's been proven safe and effective for decades. The most common adverse effects are pain, swelling, and redness at the injection site. A common misconception is that the vaccine gives you the flu. Not true. If you get the full-blown flu following the vaccine, it may be because you were exposed to the virus immediately before or after inoculation, and the virus is incubating in your body. It takes 2 weeks to fully build up your immunity to the virus, so it's possible to contract the flu in that period of time. And if you do feel a little off or under the weather after the shot, it may be because your body is building up those antibodies and fighting those proteins against the virus. I also know that many people are worried about the chemicals and additives that are listed on the vaccine. Those are used to preserve the vaccine and prevent it from losing potency over time. Mercury and aluminum are the most talked about ingredients, so I will address both of those. There is no actual mercury in any vaccine. Mercury compounds are used as a preservative to make sure the vaccines don't become contaminated. Those compounds are as different from mercury as table salt is different from chlorine, even though chlorine is one of the components of salt. It can be harmful to you, but we eat salt every single day and we're fine as long as we eat the right amounts and don't overdo it. Doctors really encourage the public to think about how things are composed. As for the aluminum, we already have it circulating in our bodies. We get it in our food and our water supply and in the air we breathe. Our bodies are designed to efficiently get rid of waste. The CDC says almost 100 children die each year because of the flu. Therefore, if there is a medication that's going to cut those risks by 50%, doctors recommend to take that medicine or vaccine in this case. The good news? Worldwide, there's a lot of serious research going on into a universal flu vaccine, which would be a flu vaccine that would be given once or maybe a couple of years rather than annually. But they could not confirm when that, in fact, would be available. We're all keeping our fingers crossed for that to happen sooner rather than later. Rose Beltz, KREM 2 News.